Hello friends, today we'll check out the difference between 78, 79 and 58 modifier. These are post-operative modifier which are used within the global period. So it is very important to know the difference between these because many people have confusion between 78 and 58 or 78 or 79. So this video will help you to clear your doubt. So first let us check out the difference between this modifier. So first should know the definition of 78 modifier, that is return to the operating room for a related procedure during the post-operative period. So this modifier is used when a subsequent procedure is related to the first and requires the use of the operating room. A new post-operative period does not begin with the use of a 78 modifier. So this subsequent procedure which is happening within the global period, that is 10 days or 90 days, should be related to the first procedure. Then only we can use 78 modifier. And the planning and the return of the patient to the operating room should be unplanned. If it's an unplanned return of the patient to the operating room for the related diagnosis of the initial procedure, then only we can use 78 modifier. If the patient is returned to the operating room after the initial operating session, even if on the same day as the original surgery, for one or more additional procedure as a result of complication from the original surgery, use modifier 78. So even if it is coming on the same day for any complication of the initial procedure, you can use that subsequent procedure with 78 modifier. It doesn't depend whether patient is coming next day or same day. The procedure should be just related, and the patient should come back to the operating room in an unplanned way, and then only you can add 78 modifier to the subsequent procedure. And do not use 78 modifier when the original surgery is repeated. So if same procedure is repeated, we have a separate modifier called 76 for this procedure. So this is the difference. This is actually about 78 modifier. Now coming back to 79 modifier, which is unrelated procedure or service by the same physician during the post-operative period. So the modifier 79 indicates that the procedure or service that was performed during a post-operative period of another procedure but is not related to that surgery. So only minute difference between 78 and 79 is 78 is related and 79 is unrelated. Do not use modifier 79 to report stage or related procedure or services performed by the same physician during the assigned post-operative period of a procedure. So for any stage or related procedure or services performed by the same physician, we should not use 79 modifier, because for stage and related procedure we have a separate modifier called 58, which we will look out in next slide. An ICD-CM code must document the medical necessity of the service, since the diagnosis or the service differs from those reported within the initial procedure. So the ICD-10-CM diagnosis should be different for this procedure, subsequent procedure and the initial procedure. Then only you can come to know that they are unrelated to each other. If the diagnosis is same, you cannot use 79 modifier, because then the procedure is completely related to the initial procedure, and that is why you have to have separate diagnosis for the subsequent procedure within global period and the initial procedure which was done initially. Now, if reason for unplanned return, so for 78 modifier we have some coding tips. If you can follow that, you can easily use 78 modifier. So for an unplanned return is generally due to some complications or mechanical failure. So these codes, mostly these diagnostics codes comes in the range of T80 to T88. So when you see any complication of previous surgery, like if they have placed any catheter or they have placed any stent, so suppose that stent got displaced or got any, so in such cases those codes will get to lead to mechanical complication. So those codes will come to this range, T series codes. Even some surgeries happen and previously and suddenly some bleeding is coming from the surgery site, so those are also complications. For that, patient will return to the operating room within global period. On those cases you can use 78 modifier for the procedure done for those complications. So when the procedure is related to the first and required the use of the operating room or procedure room, it may be reported by appending the modifier 78 to the related procedure. Same thing which we discussed. Now 58 modifier is very related to 78. Only thing is here the patient is coming in a planned procedure, like it's a stage or related procedure or service by the same physician during the post-operative. The physician may need to indicate that the performance of the procedure or service during the post-operative period was planned prospectively at the time of original procedure. That is a stage procedure, and it should be more extensive than the original procedure. So here the physician already plans for the next subsequent procedure, and it should be more extensive than the original procedure. So some procedures will take 2 to 3 surgeries. In such cases the physician will plan initial procedure first, and he will plan the next procedure after some period of time. So those procedures which are staged or planned within global period, we have to append 58 modifier. Opposite to the 78 modifier is unplanned, but it is related to the initial procedure. Here 58 is also related, but 58 is planned. So this is the minute difference between 78 and 58. Now here are some scenarios, like see a 70-year-old female patient undergoes left simple mastectomy and sentinel lymph node biopsy of ductal carcinoma in situ of left breast. During the post-operative care, the patient develops swelling and pain, and these are actually the complication happened in the post-operative period over the chest wall with copious bloody drainage in closed suction drains. She is taken back to the operating room and to undergo a surgical evacuation of the hemata. What will be the appropriate modifier, 58 or 78? So for this scenario, it would be appropriate to report codes 35820. This is the second procedure, subsequent procedure happening in global period. So they are telling to append 78 modifier. So here actually he came for any swelling or pain happened to the same site, so for the left mastectomy. So in those case it's a complication happening because of that surgery. So here we are adding 78 modifier. So 78 modifier is so during the post-operative append because the subsequent procedure occurred during the global period of the mastectomy. So it is happening in global period, so we are giving 70 and was an unexpected return to the OR. So this is like an unexpected return. This was not planned. So if a subsequent procedure was planned or performed on a stage or a more extensive procedure, it would be appropriate to report relevant CPT code and append 58 modifier. So it was not planned, so that's the reason we have given 78 modifier. If it's a planned, then we would have given 58 modifier. Second scenario is a mastectomy was performed on a patient, and a 1 week later a central line with port for chemotherapy was placed by the same surgeon. What is the appropriate code to report the catheter and post placement procedure? Should a modifier be reported because the procedure was performed within the global period of the mastectomy? So here they are asking what will be the procedure code for the subsequent service performed. The catheter and the chest placement should be reported with 36561. This is actually an IVR code, insertion of tunnel centrally inserted central venous access device with subsequent port for age 5 years or old. So modifier 79 should be appended to code 36561. It would be inappropriate to append 58 modifier during this post-operative to code 36561 because the port is in different location and is not a stage or more extensive procedure to the mastectomy. So here we are adding 79 modifier because of I think here location is different, and so the diagnosis will be different. So we will add an unrelated procedure or service for the same physician. So we will add 79 modifier because this is different to the initial procedure. We can't add 58 modifier because it is not a related or a stage procedure in this scenario. So compared to previous scenario, the procedure was related. Because of the complication happening in the same site, but in this scenario the location is different. So we are appending modifier 79 which is unrelated to the initial procedure. So this is the actual difference between 78, 79 and 58. So you have to see the previous reports as well, where the patient has gone in surgery or not, and we have to calculate the global period based on the CPT code, like 10 days, 90 days, and what are the procedure happened in those global period, and those CPTs are whether related to the initial procedure or not. Then on the basis of that we have to give this global period modifier or post operative period modifiers. So thank you for listening to this video and watching this video. If you like the video, do share it, and please comment in the given box to know what topics you want in future to be discussed. Thank you again, and do subscribe to my channel. Thank you.